really disappointed to have received that notification. It was a difficult email to see, and actually I took it was quite shocked when I received the email, because we were actually meeting internally to continue planning on the MPS response, and then to see that all of our partners at the CDC had been let go was pretty difficult. At this point, we don't have any contacts at the CDC for childhood lead poisoning. It's a pretty stark moment for us in the department to not have someone to reach out to federally. We have our local partners as well as some national partners at other health departments, local health departments, but this is a pretty unprecedented scenario to not have someone to turn to at the CDC. So I'm happy to answer questions to that, or any other questions on where we are right now.
How long had you been working with the CDC prior to that March 26th request?
Yeah, so I think it was in early February. I mean, really right away, once we realized the potential scale of what was going on at the district. So 68,000 students, over 100 buildings that we were concerned about. So we reached out right away with our state partners to the CDC, and they got us connected with their folks in the National Center for Environmental Health and their childhood lead prevention program. These are the same folks that actually worked on the national applesauce recall that had lead in it last year, if folks remember that. So these are folks that are really specialized in understanding the broader implications to population health. So we have been working with them basically from the beginning on initially sounding board some of what we were thinking through for triaging some of the schools, and then they were going to physically send some teams here to help us with the epidemiologic investigation into the potential lead exposures. As we know, with lead exposure, sometimes there's an acute exposure from like a real quick exposure to lead, like ingestion of paint chips would be an acute exposure, but then the more chronic exposure, like inhalation of dust, lead dust, is something that we're really concerned about with this whole scenario because of how long the paint has been allowed to degrade in the schools. So that's why we engaged with them right away. And then, you know, up until we got the notification that that team had been let off, we had no indication that this was going to happen. So that was pretty startling to have us planning. We had submitted on the 26th. They acknowledged receipt. They started working the request to send staff here, and then all of a sudden, overnight on the 1st, it was all done. So.
I know it's detailed here in your letter for your request, but what exactly were you looking for the CDC to do once they were here? Yeah,
so as we noted in there, with the epidemiologic investigation, it's really understanding how a child might have been exposed at their home versus at the school. Given the lead hazards in our city that exist in over 80% of our residential properties, we really wanted to make a pragmatic plan to approach each of the children that tested with an elevation or a lead poisoning, and quickly discern, is it from their home or is it from the school? Is it a combination of both, which would make it even more complicated? So the CDC's team was really going to come help us look at that data as we started to collect that, and then they were going to help us with the data collection itself and actually help staff some of the testing clinics. Because when we do the testing clinics, there's a lot of data entry that happens as the capillary screening's happening, and we want to make sure that we're looking at it real time as we have this up until this point. So.
You used the word team a couple times in there. How many people were you expecting to come from the CDC? I've seen some articles describe it as 8-person.
Yep.
You're talking about a team.
Initially, I think their discussion was around 3 to 4 people would physically come to Milwaukee, and then the plan was for ongoing technical assistance to continue to happen virtually. So there was a whole other set of individuals that would stay in Atlanta, advising us over the phone and over Zoom. So that was the ongoing support that was going to happen, and then they would physically have assets that would come to Milwaukee to be with us in our meetings and help us when we're at the screening clinic. So we were anticipating about 3 to 4 people to be here for, I think it was 4 to 5 weeks. And then from there, then we would evaluate if we needed to extend it or if we needed to bring in more people. But the part that I would stress is that team these are the top, experts in the field for lead exposure, and we have really excellent internal expertise, but these are folks that see lead issues at a much larger scale than we do normally here in Milwaukee.
What's the progress on requesting help from the state?
So the state's been a part of this since the beginning. Initially, our investigation started locally, and then we've encouraged continued collaboration with the state. So the state issued orders slightly after we issued orders around mainly the focus with the vendors that the district was using, And we continue to collaborate with them. They've also been a part of our meetings with the EPA as the EPA has been looking at the asbestos issues in the district. But there's what folks might not realize what the Epi-Aid request is sent jointly with the state. So we as the local authority would initially come up with that request, and then the state also co-signs it. So Dr. Cheryl Bedno, who's one of the chief medical officers for environmental health for the state, she co-signed our request because part of that request would be working with the state too to ensure that they could support the state with the response.
Is there a timeline for these schools that are closed currently to be reopened, or is there still?
Not yet. So Fernwood is the one that's furthest along right now. It's going on week 5 of closure, which from the town hall briefing that happened last week, the district spoke to just the level of repair that had happened, which was significantly worse off than they had initially anticipated. So we're ready and ready to go once they give us the green light to come in and do the clearance testing. Our team's ready. We have our lab on standby to do the processing of samples. So we really want to get the kids back in school once it's safe.
How
What
close
was
are we
having
to?
the team, the CDC team here, what would that have meant for the timeline? What would that have allowed you to do that you're not able to do now that you don't have that team coming?
Part of that is having the additional expertise to help us triage the information. So right now we've delayed some of our screening to give us a little bit more time to plan for the lack of staff from the CDC. The other part is the bigger question of if we start to see really complicated blood screening data that we're having trouble to figure out, we'll work with our state partners as we normally do, but now we're not going to have the experts at the CDC to call and say, hey, we saw this variance in the data. Have you seen this before? We don't have that model to call anymore. We've worked with our other local health departments across the country in this moment. We've talked to a lot of colleagues down in Cleveland, Ohio, but they're dealing with the same kind of scope that we are with the local issue versus a national view. The CDC brings that expertise and the bigger picture that we just don't have eyes to because we're here focused on the mission here in Milwaukee.
How
So right
close
now,
are
you do
we?
not have any contacts with the CDC when it comes to lead poisoning?
Correct.
Has that ever happened before?
No.
How close are you to releasing the lead remediation plan?
From what I understand, it's going pretty well. I think there's just a couple revisions that they're doing. My understanding is it would be done in the next couple weeks or so. The main thing that we really wanted to focus on with the district was that it was actionable and that we could make sure that it was going to be implemented. As we pointed to for the last 4 months, the district had a plan. They just hadn't implemented it. And making sure that the district has a plan that they're going to follow is the bigger part. And we're still working with the district and city leadership to make sure that we can actually support the district long term and making sure that the district can follow the plan. I don't know if you want me to repeat any of that. So we're working with the district right now to make sure that the plan is actionable and that we can actually follow it and implement it. And then long term, we're working with the city leaders here in Milwaukee, like the mayor's office and the council and the district, to ensure that the plan is going to be followed and adhered to.
How has your working relationship with the district changed in the last couple of months? There was some communication misfires earlier this spring. There's a couple of new folks, one from the health department who moved over to MPS. How has that relationship changed, and will it serve the students who are impacted by this?
That's a great question. Dr. Caselius and I started talking right away once her contract was finalized, and was really encouraged by the questions that she was asking. She's very thoughtful, really approaching this from a pragmatic lens of trying to get the work done. This is a really complicated issue, and the scope that we're dealing with is significant. They also have, academic outcomes that they're really trying to bring up through the district. So over these last couple of weeks, Dr. Caselius and I have spent a lot of time talking through where we need to be, and it was really that communication that opened up the request for help. Dr. Caselius reached out to the mayor's office looking for additional support, and we were able to lend the district Mikhail Mannon, who's a director of home environmental health, so he leads our lead program for the department. And extremely grateful that we have that expertise to lend to the district. I'm optimistic that even if Director Mannon is there for 3-4 months, it'll help the district really understand what their obligations are and help them make an achievable plan that they can follow. I'm optimistic, and I hold out hope that with this continued collaboration and Dr. Caselius's focus on the significance of what's going on, that we will find a better path for the district, ensure that we're going to turn the page on this.
Are there any
So-
federal dollars you're missing out on because of this denial?
No, not at this point, but we are concerned globally about what the CDC is funding and not funding. We lost $5 million a couple weeks ago for some of our COVID era grants, which were really geared at recovery, not necessarily response. So that was a clawback of $11 billion nationally that happened. And when we lost that $5 million, it started for us to be concerned that we might lose additional pass-through dollars or direct awards that we have from the CDC or other federal agencies. The part that's really concerning for us is there hasn't been any communication warning us of these changes and shifts in personnel. April 1st was a really stark moment for public health here across the country, and specifically here in Milwaukee, where now we don't know who to call, we don't know how to respond to some of the challenges that we have dealing with right now, because we don't know if I'm reaching out to someone today, are they going to be there tomorrow? And part of what we've done over the last couple weeks since the terminations went through is to try to consolidate across the rest of the health departments we work with across the country to say who's still in place, who's on first, who's on second, so that we know who our good contacts are, and we're still working through that right now.
The experts that you've worked with at the CDC, presumably they're unemployed now. Any thought of reaching out to them individually, bringing them in on a contract basis to advise you going forward?
That is something we've considered. The challenge is our lead program and a lot of the funding that we receive to do the work is so limited to our normal response. We're not really funded in a way to staff up to a challenge with the well, I'll give that a second. It's just that bean burrito I had for lunch here. Part of our challenge is local health departments across the country are funded largely to do a particular service program. So with the pandemic, what happened was when we were in a larger scale response mode, the federal government had to come and support and augment with additional dollars to support scaling up to that response. As I've spoken to before, with the current situation in MPS, we're really still in that beginning stages of understanding the potential scope of this. Chronic lead exposure can happen over months or even years, and if the paint degradation at the schools has been ongoing for as long as we think it is, there are those chances that there's more long-term, lower scale lead exposure happening. And scaling up to meet the needs is challenging given that we don't necessarily know how bad it's going to get. So the CDC sending their team here was going to help us actually look through the data that we were going to be receiving through the screening clinic, and our next screening clinic is a large-scale one is going to be in early May. I think it's the 7th. And then in the interim, we have all these other smaller pop-up clinics at Children's Wisconsin 16th Street Community Health Center is going. So we've been fortunate that our community partners are helping with that, but still on the back end, we need additional expertise and support. So if I can shake out some additional money, I would love to bring on some additional expertise. At the same time, our immediate response right now is to help the district get their plan together and ensure that the students and parents here in the city get their kids screened. The broader policy implications and what we do with that information is something we're actively going, and we are considering that question of bringing potential former feds to the city.
Where are you looking for money right now?
Everywhere. We've been dealing with lots of noise.
Sorry, I tried calling DPW, I don't know what's going on.
So right now we're really fortunate that our Children's Wisconsin partners are doing the clinics for free. Same with 16th Street Community Health Center. The ongoing costs, we're tracking our overtime costs really closely and our other costs for supplies to do the testing and clearances at the district. But right now we're in conversations with lots of folks from private foundations to our city leaders about additional costs.
I know that you guys have been holding these clinics for a couple weeks now. I mean, do you have any sort of number, ballpark number of how many children have tested positive?
Thankfully it's been very low, so we're really encouraged by that. We're also encouraged by the larger population data for the city to see that parents are bringing their kids to get screened too. And again, there aren't any additional cases that we have identified at this point, which is a really encouraging sign. But as we're, again, still ramping up the testing, we anticipate finding more cases at this point. And then we're still following up on the complaint-based process. So there is at least one additional suspect case that's been referred to us that we're investigating now for potential lead poisoning at the school. But at this point, it's been a relatively low number, and we hope that it stays that way.
What school is that suspected?
I don't have that in front of me right now, but it's a school that we haven't been in yet.
You mentioned that you were working with Dr. Caselius before. What was your immediate steps after the CDC withdrew from the partnership with you guys? What was your guys' immediate?
We just continued planning. We have to respond to what's happening in the community, and again, really grateful to our clinical partners for helping us with the screening clinics. The CDC were going to help us think through some of that planning, but Children's of Wisconsin has really taken a major step in helping put the screening clinics together. On the other side of that, we've also encouraged the district to offer testing for all of the students at the affected schools so that parents can have that routine or reassurance of their child's lead levels.
We've got time for
There's
two more
more
questions. There's more than 100 buildings in the district. What's the timeline of testing those other schools?
So I forget if this is, I know it's going to be part of the plan that the district's working through, but they had already contracted with a third party to do assessments at the rest of their schools. So they have an ongoing timeline of what they're going to do with the remaining schools in terms of when they're going to do inspections. And then with Director Mannon working with the district this week and ongoing for the next couple of weeks or so, we're really hoping to help prioritize that list to make sure that the schools at the highest risk for potential exposure for kids, like schools with children under the age of 6 and students with developmental needs, we want to make sure that those schools get seen first. And then they also have other schools that have had capital investments like new windows and doors, so we might move those schools lower down on the list that might not need to get into right away. Fernwood and Starms and La Follette were all schools that we had identified through our prioritization process, and Fernwood is actually one of the schools that the district asked us to go into. So again, it's this back and forth. We're going to respond to the actionable information that we have, and as we've said this whole time, we'll constantly reevaluate the safety of these schools on a daily basis.
You mentioned having to delay screening because of the denial of Epi-Aid request. How long is that delay, and when are you hoping to hold the next?
It was just mainly a week or two. It wasn't significant. So not having the Epi-Aid here to actually have the staff here, that was a little bit of a pause on our end to make sure that we had all of our planning in a row. So in the grand scheme of our response, it's not going to affect really the large-scale timing of it. It's more of not having the expertise who can help us look through the data in a way that we might not be considering because we haven't looked at such large-scale screening data before.
The layoffs at the CDC were designed to eliminate waste, fraud, and abuse. Does eliminating the CDC's lead prevention program, lead contamination prevention program, eliminate waste, fraud, and abuse?
Well, from what I understood was shared by HHS leadership was that it was really focused on that part, but not necessarily focusing on eliminating scientists and frontline support staff. I can tell you the people that we were working with at this the childhood lead prevention program were epidemiologists and medical toxicologists as well. So those are staff that are actually doing the work and have technical expertise that, say, a somewhat redundant administrator might not have. So we were really disappointed to have this happen, but again, we're responding with what we have and with our partners that are still here today.
Thanks, everybody. Appreciate your time.
Thank you.
EPA is still helping?
Yes. Yep.
EPA is still helping with the site inspections?
Yep.
And has Epi-Aid been